Hi, this is Dr. Ty Vincent, another LDI-related video. I want to talk about tests and testing in general. I don't really order a lot of tests for people. I don't order any tests for LDI specifically because I found that test results just aren't really that helpful. And I've talked about this in prior videos and at conferences, and people get the false impression that I just don't believe in laboratory tests in general, and that's not true. What I talk about with tests not being helpful is when you're running tests trying to identify what your immune system is reacting to. Those kinds of tests are fraught with all kinds of false negatives, false positives, because there are lots of different pathways and mechanisms by which the immune system can react to something. So if you're measuring IgG antibody, that might not be the type of mechanism involved with a particular reaction. It might be IgA, it might be IgE, it might be cell mediated. So you might be missing it. And you will also get a lot of false positives for things. For example, Epstein-Barr virus. Everyone over 30 or even younger really pretty much has Epstein-Barr virus. And if you run tests, you'll find elevated antibodies, you'll find elevated viral loads. And so a mistake that doctors make a lot is they'll have a theory, a suspicion, right? They'll say, oh, your symptoms sound like they could be Epstein-Barr virus related. Then they'll measure your Epstein-Barr virus tests with a viral load or the antibody, and sure enough, they're elevated, and they go, yep, see, I was right, that's your problem. That's called confirmation bias. And it's one of the major flaws in the human brain and psyche is that when we get new information, we just decide that it agrees with us, right? If it seems to agree with our existing beliefs, then we think it must be true and it validates our existing beliefs. And that's not how science works. So with Epstein-Barr virus, for example, just about everyone runs elevated levels, and anyone can on any given day, depending on what's been happening to you. Like if you have any immunological issue going on, let's say you have Lyme disease, you have allergies, and you're exposed all the time, your immune system is just generally pissed off, you're going to have elevated antibody markers to all kinds of things. Just like if there's a fire in a skyscraper with 1,000 offices in it, the fire alarm goes off in every single office. It doesn't just go off in the room where the fire is. And that's how these laboratory tests come out. You'll have elevated markers for HHV6, Epstein-Barr virus, Lyme disease, mycoplasma, the whole list. You're used to seeing these things. They're all off the charts. And patients come in and go, I have this organism, I have this organism, I have this organism. Well, number one, antibodies don't mean that you still have that organism in your body. Like if you got a measles vaccine when you were a kid, you'll have elevated measles antibodies till you're 100 years old. It never goes away. Your immune system has a memory. So antibody tests don't mean anything in real time about what's happening to you today. And they also don't indicate which thing is responsible for which symptoms. So all the antibody tests are not very useful. Having an organism in your body also does not mean that that organism is causing your symptoms. So people will do DNA-based tests for the Lyme organisms, Borrelia, Bartonella, or whatever, or other organisms, and they'll say, I have this organism, that's what's causing my symptoms. It doesn't mean that, because you can find, for example, the Lyme disease organisms like Borrelia in virtually everybody. If you bother to do the tests, you find it in completely healthy, asymptomatic people all the time. So that doesn't define the illness. Think about it also with like COVID-19. 75% of people that would catch the coronavirus had no symptoms at all, but you would test them and they'd test positive, and yet they're asymptomatic. So you see that the organism itself does not cause the illness. Finding the organism inside somebody is not proof that it's related to the symptoms that they have or causes the illness. Stool testing is even worse. You do a stool test and you find out you have all these organisms in your gut. And what I can tell you dealing with immune reaction problems is that what you find living in the person in abundance is clearly not their problem, which sounds backwards, but when you're dealing with an allergy sort of reaction or an immune reaction against an organism, that means your immune system is not tolerating its presence. And so you're more likely to find it not there. The best example I can have is with yeast or candida. A lot of patients that I see that are extremely sensitive to candida, when they do a stool analysis, it will show no yeast or extremely low levels of yeast. And that, interestingly, doesn't get flagged on the test as being abnormal. But what it does mean is that that person's immune system is not allowing candida to live in their gut like it normally would. So it is a very significant result to find that the yeast is not there. But the doctor doesn't think it's significant. And again, this is part of the problem. The laboratory tests don't really reflect what's going on. So I don't rely on those things, and they aren't very helpful. But most of you will have lots of these tests run and done by other doctors. They'll chase all the rabbits down the rabbit trails, and maybe you'll get lucky and you'll treat something that actually matters. And then that's your confirmation that that was the thing. Like for us, If you have a lot of different symptoms, we might start with the Lyme mixture, then maybe yeast, then maybe other things. And eventually, hopefully we find one that works. And so in retrospect, we can look back and say, oh, you were reacting to Candida, or you were reacting to Borrelia or Lyme or something. And we wouldn't have known that at the beginning just based on the test results. You have to do the experiment to validate it. So those kinds of tests I don't care about. But if you have hormonal test levels, nutrient test levels like vitamin D, all these things, your blood counts, most laboratory tests are totally useful and valid. And I do treat patients for other problems. I do hormone management and I help people sort out other chronic disease issues that they might have. So other tests are very useful to me when they're measuring something that is concrete and is meaningful. It's just this immune reaction kinds of testing and the organisms that are living in you, those sorts of tests that are just not helpful.